You're in for a treat this evening. The naturopathic perspective on digestive health has a lot to offer. And so I would like to turn it over to our guest. We're so delighted to have him here in Parksville. And thank you very much for joining us today, Dr. Yim.
First of all, thank you, Lisa, for that kind introduction. Thank you, PharmaSafe, for sponsoring this. Thank you to Salvation Army. Most of all, thank you all for coming out. And thanks to the volunteers for helping my wife put those little cards on the seat. You know, when I put together a talk, I always wonder, what kind of interest is there going to be in my topic? And most importantly, how many people are going to come? So it really gladdens my heart to see such a great turnout. And what that tells me is that there's a lot of interest about gastrointestinal health. So how many of you are here tonight to gather information for somebody else, a friend or a family member? Okay, just a few. So that means, how many of you are here to gather information for yourself? Great, okay. So I guarantee you, you're going to leave here tonight with a lot of useful information that you can put to use right away to improve your digestive health. I want to start by sharing a story. I have a patient, Lucy, and she's 70 years old. When I saw her 5 years ago, she was diagnosed with rheumatoid arthritis. She hobbled into my office with a cane, and she said, "Dr. Yim, I'm in excruciating pain. But the worst thing is, I've had to give up so many things I enjoy. I've given up gardening, I've given up hiking, and the worst part is that the thing that my husband and I love the most in the world is dancing, and I've had to give that up as well. I have no quality of life." Now, during the interview, I asked her, besides the arthritis, do you have any other health symptoms? And how long have you had them? And she said, yes. I have gas, bloating, I have abdominal pain, and I have loose bowels. I've been diagnosed with IBS, irritable bowel syndrome, for the last 15 years. My doctor has done all the tests, he's scoped me, he says there's nothing that they can find. I'm just going to have to learn to live with this. And I've lived with it for 15 years. So, with a show of hands, how many of you think that these two conditions are distinct and different? Okay, it's a trick question. How many of you think that they're connected? Great. You and you and you and you and you are all right. They're connected. The reason that this talk tonight is called Healthy Gut, Healthy Body is that the health of your gut influences every other system of the body. And when your gut's not healthy, your body's not healthy. And I'm going to show you tonight how Lucy's IBS led to her rheumatoid arthritis. And through the talk tonight, I'm going to tell you how we treated her. So, why is the gut so important? I can just see I'm going to walk into this tonight, right? Here you go. So my belief is the digestive system. So just to qualify this, when I use the word gut, I'm being lazy. So rather than saying digestive system all night long, when I say the gut, I'm using it synonymously with the digestive system. And if I'm talking about the liver, the small intestine, large intestine, I'll use those words, okay? So when I say gut, I'm just talking about the whole digestive system. So every other system of your body is influenced by the gut, right? And the reason is, the second point, the gut's the gatekeeper. It keeps out things from the blood that shouldn't get into the blood. Large proteins, toxins, microbes like bacteria and yeast. So it's the gatekeeper. It should not allow things into the blood that don't belong there. But it should absorb your nutrients, right? And if your gut's not absorbing your nutrients properly, that impacts every system of the body. Does that make sense? The third thing, it's the largest area that has contact with the external world. You know, we think of our skin as the largest contact with the external world, but really, it's the inside of your gut. You know, we think that the digestive system, this tube that runs from the esophagus, small intestine, large intestine, we think of it as being inside our body. But until things get across the lining into your blood, they're in you, but they're not in you. They're going through you. Does that make sense? So the 49th parallel is the border between Canada and the US, and it's not well defended. But the lining of your gut, because there's all kinds of bacteria, yeast, parasites that can get down there, the lining of your gut is heavily defended. In fact, the majority of your immune system resides in your gut. Yes, there's some in your blood. Yes, there's some in your skin. But the reason that so much of it is in your gut is that we have over 20 feet of small intestine, over 7 feet of large intestine, and when all the folds and convolutions are spread out, it's the surface of a tennis court. It's huge. So that's a big, big area for your gut to have to defend. And then the last thing, second to last thing, houses a huge population of microbes. How many of you heard the term microbiome? Have you heard that term? So that's the constellation of all the different organisms that live on and in us, right? And the gut houses a huge number of microorganisms. Did you know that there are 10 times more bacteria in the gut than there are human cells in the body? Isn't that fascinating? We are hosts to microorganisms, right? It's kind of like a science fiction show, you know, we're like zombies being run by bacteria. Because what we're finding now is that not only are the bacteria important for our digestive health, they can actually influence our moods. They can influence our immune function. They can even influence our weight. Isn't that wild? The type of bacteria you have in your gut can even influence your weight. And then the last point, the digestive system disposes toxins and non-essential elements. And that's really important because we got to get rid of our waste. Otherwise, we poison ourselves. So that's just a few reasons why the gut's so important. As far as digestive conditions that people suffer from, what are some health conditions that affect the gut? Shout out a few. Shout out your own. Share with us. What have you got? Celiac. Somebody said celiac. Pardon? Anything else? Yeah, good. Ulcerative colitis. No, gut. Osteoarthritis can be aggravated by the gut, but we're talking more about digestive symptoms. Crohn's, right. So Crohn's, small intestine, colitis, large intestine. Anything else? Pardon? Lupus is an autoimmune disease, again, can be contributed to by gut problems, but it's not a digestive disorder. Okay. GERD. GERD. What does GERD stand for? Except the person that said it, what does GERD stand for? G-E-R-D. Gastroesophageal reflux disease, right? It's not really a disease. I think it's more of a symptom. But yes, so GERD. Here's a bunch more. These are just a few, right? Now, most of those make sense, but there's a couple on here that you might not know what they are. Anybody? Oops. Anybody know what hypochlorhydria means? Break the word down. Hypo. Yeah, there's a hand that went up. You might get a chocolate bar thrown at you for a treat if you get this one right. Were you just stretching? Perfect. Hypo means low, right? Hyper is over or too much. Hypo means low. Chlorhydria has to do with stomach acid, low stomach acid. The reason that that's up there, most of us wouldn't think of that as a disease of the gut, but it's a contributor to many health problems because if you don't have enough stomach acid, what can happen if you don't have enough stomach acid? You can't digest things, that's right. And the problem is that when it comes to Western medicine, what is one of the most common medications prescribed when you have digestive disorders? Antacids, acid blockers, right? So it's true that when you have uncontrolled GERD, that can inflame the lining of the esophagus, and if it's not dealt with, it can lead to cancer in time. But if you block somebody's acid production, you're messing with their digestion of their foods and the absorption of their nutrients, especially their minerals and things like B12. Those things need acid. And if you're blocking somebody's acid and they're a senior citizen, right? Patients that are on acid blockers for 5 or more years are at increased risk for fractures. Why is that? Exactly, you guys are so smart. If you're not absorbing your calcium, you're more at risk for bone fractures. And in the old days, the insurance statistics said that senior citizens, if they're older, if they fall and break a hip, many of them are dead within 5 years. So here you are trying to prevent esophageal reflux, but if you're using a medicine that blocks somebody's acid and you're increasing the risk for fractures, you could be dooming them to osteoporosis and eventually something even worse, right? So yeah, that's why that's up there. And I'll talk about dysbiosis later because that's really important as well. So what are the symptoms? What are some of the symptoms that we can have that let you know that, hey, there's something wrong with my digestive system? Gas. Heartburn. Vomiting, yes. Acid reflux, yeah. Diarrhea. Cramping, nausea. Perfect. And there are probably others as well, but these are the most common ones that people can get. Now, I mentioned earlier that when there's problems showing up in the gut, it can lead to problems in other places of the body. Somebody mentioned osteoarthritis, somebody mentioned lupus. What other things do you think that if your digestive system is not working properly, what other health conditions do you think that can be aggravated by gut problems? Diabetes, yep, more from the diet, right? If you're not eating properly, yep. Brain fog, that's another symptom, yeah. But as far as health condition outside of the gut, yeah, the brain can be affected. So what other brain symptoms can you have? Dementia, Alzheimer's, depression, yes. Pardon me? Headaches, definitely. Yeah, here's my list. Yeah, there's the rashes, right? Dermatitis, headaches. Look at this, neurodegenerative disorders. Do you know that people that have Parkinson's, there's signs of changes in the gut 20 years before symptoms show up? 20 years. That is absolutely staggering. And you're right, the dementia is one thing, but Alzheimer's is way worse. Now, many of these conditions are multifactorial, right? We know that heavy metals, inflammation, high blood sugar, all those things can contribute to Alzheimer's. What I'm telling you is that problems with the gut is another contributor. And then psoriasis, rosacea, so these are different. Dermatitis, I'm thinking about things like eczema, right? Okay, so things that injure the gut. Anything else that you can think of other than what's on that list?
What about
Cannabis?
cannabis?
What's wrong with that? I can't wait to be able to dispense that. No, with nausea and poor appetite and stuff like that, cannabis really works. It's helpful. I don't know that cannabis causes any digestive problems. So was that your comment that cannabis? Oh, yeah, yeah. So, no, I haven't found anything that says that cannabis can contribute. Spices? Some people, yeah. Not everybody, but some people are aggravated by spices. So here's something that's interesting. So I put the number 4 beside medications because there's 4 main classes of medications that are really, really hard on the gut. So we talked about one class already, and what was that earlier? Yeah, acid blockers, right? How about a couple more, do you think, that could affect the health of the gut? Antibiotics, right. Antibiotics are very useful. When you have an infection, like if I have an infection that's out of control, I'm not going to Golden Seal. I'm going to my doctor for an antibiotic, right? Because if it's life-threatening, I want to use what's going to kill the bacteria. The problem, though, is that in our society, oftentimes antibiotics have been overused. And what can that lead to? Especially for you women out there. Yeast infections. And when we talk about dysbiosis, an imbalance between bacteria, friendly bacteria, and yeast is one of the most common types of dysbiosis out there. The other thing is that with antibiotics, they kill all good bacteria and bad bacteria. They're broad spectrum. The problem is that your friendly bacteria, I mentioned earlier, is a huge part of your immune system. So when you slaughter your friendly bacteria, what you do is you weaken your immune system, and in the future, you're more at risk for another infection unless you do what? Right, you replenish the bacteria. And that's why you go see Lisa or you go to the health food store or whatever, and you take a probiotic. How many of you have ever gotten a prescription for an antibiotic where your doctor has told you, oh, by the way, you should go to the health food store and get some probiotics? Anybody? 1, 2, great. Is that recently or years ago? Recently, good, yeah. Unfortunately, years ago, doctors didn't think it was important, and so they never told their patients to do that. So they were setting their patients up for dysbiosis. And when women get vaginal yeast infections after antibiotics, it's not like the antibiotics caused the yeast infection. The antibiotics killed the friendly bacteria that were competition to the yeast. And so when there's no competition for the yeast, that's why the yeast overgrow, right? So we need to be very judicious with our use of antibiotics. And when we use them, we need to take probiotics to replace our friendly bacteria. Stress. How many of you here do not have stress? Okay. I will argue that point with you. I think the thing is that some people, they don't have as much stress in their life, and their perception of things in their life is very good. But here's the thing. We are all under stress, because stress is basically anything that makes the body have to adapt. And so some challenges are more stressful than others, right? But we need some stress in our life. It's not a bad thing as long as it's not overdone. The problem is that some people, when they're under chronic stress, the sympathetic nervous system, which causes a fight or flight reaction, is constantly in overdrive. And that can have tremendous impact on your digestive system, because your digestive system works better when you're in the parasympathetic state, which is the opposite. So that's why I tell my audiences, if you're having a fight with your spouse and it's dinner time, walk away from the dinner table, because if you eat your dinner, you're not going to digest that meal as well as if you're calm and relaxed. Because when you're in the fight or flight state, survival is what's important, not digesting your food, so blood goes away from your digestive system. Digestive enzyme production is lower. The motility of your gut is reduced. So all those things are negative. The other thing that's very interesting is that when you're under stress, it can actually impact the bacteria in your gut. Isn't that wild? They can actually pick up on your emotions. That is so interesting. So it's much better when we're eating to be calm and relaxed, right? So when you're eating, peaceful environment, right? Savor, the look, the smell, the colors of your food, and the taste. Yes, turn the TV off so you're not distracted. When you're distracted when you're eating, most people tend to eat more. So when you're mindful when you're eating, it's easier to sense when you're full, right? When you're being distracted, you can just keep shoveling away. What are we talking about next? Okay, so these two things, dysbiosis, leaky gut. So with the inflammation and injury leading to leaky gut, who knows and can explain in very few words what leaky gut means? Lisa, you should know this, right? You don't get to answer this. Okay, so this question is for an energy complete bar. So that's enticement to answer this, because I know some people out there know the answer. You're just too shy to say, right? Go ahead. Right. So that's good. The small intestine has the role of absorbing nutrients, but the gaps between the cells are very, very narrow. They're actually called tight junctions for a reason. There shouldn't be a lot of space there. When you're suffering from dysbiosis, and dysbiosis I mentioned is an imbalance. It's an imbalance between the friendly bacteria that should be in the gut, so you're probiotic, and unfriendly organisms, right? There's a lot of organisms that are commensal, which means they're there, they don't help you, they don't hurt you. Probiotics actually help you, right? So the commensal ones, no problem. It's the bad ones that we don't want a lot of. So you can have dysbiosis where you have high bacteria. You can have dysbiosis where you have high yeast. You can have dysbiosis when you have high parasites. You can have dysbiosis when you have low probiotics, because it's about balance, right? Even if you have it's pretty hard to have no. If you have normal levels of unfriendly organisms, but your probiotics are low, that's still dysbiosis. We want way more friendly bacteria than we want unfriendly things. So with dysbiosis, the unfriendly organisms produce lots of toxins, and these toxins can inflame and injure the lining of the gut. And here I'm talking small intestine or large intestine. But in the small intestine, when you have inflammation and irritation, rather than having tight junctions between the cells, the gaps increase. So there's more space. And proteins and food particles that may not be as well digested as they should, because even if we're digesting things really well, we don't digest everything down into the smallest pieces. There's still a few larger proteins around. So with a leaky gut, things that should not get through the gut lining, these large proteins, they can get through. And because of their size, the immune system says, these aren't food particles, maybe they're bacteria, or maybe they're viruses. So in time, your immune system can actually form antibodies against those food particles. And once you develop antibodies against certain foods, what have you now become to those foods? Sensitive, or the other word, allergic, right? So sensitivity is when you have symptoms from the food, but you don't have any antibodies in the blood. With an allergy, there are now antibodies in the blood against those food. When you eat the food, your immune system sees those proteins, thinks it's the enemy, mounts an immune attack. That's bad. Sensitivities are transient, allergies are permanent. So by the time you develop food allergies, bad news, right? So dysbiosis from the toxins injuring the gut, anything that causes inflammation. So it could be ibuprofen, it could be alcohol, it could be stress. So anything that causes irritation or inflammation can lead to leaky gut. And once you have leaky gut and you've got large proteins and you've got toxins and you've potentially got microbes getting into your bloodstream, that can lead to havoc in your body. So how it can lead to autoimmunity is, again, when you're eating foods that your body's allergic to, it causes an overreaction. Your immune system's overreacting. And in time, it can become confused, and rather than defending you against germs, is what your immune system should do, right? Your immune system defends you against bacteria, viruses, parasites, cancerous cells. But if the immune system becomes hyper, so if autoimmunity is on the far end of your immune system being hyper, what is a little closer to normal before you get to autoimmunity? What kind of conditions? You know this one. Starts with an A. Allergies, that's right. Balance the immune system. Allergies. Autoimmunity, bad, right? Where you want to be is here. If the immune system's weak, infections. What's over here? Cancer. Ooh, see, I did it. I lasted till 7 before I ran into that screen. That's pretty good. Right, so we want our immune system to be balanced. So if you have a leaky gut and there's all these proteins and toxins getting into your bloodstream, that stimulates the immune system in some people, and other people, it weakens the immune system. So it just depends how lucky you are, which way you go. Some people have both. They get sick all the time, and they have allergies and autoimmunity. Yeah, they got the real bad draw. You can. Yeah, people can get rid of it. You may still carry antibodies, but you can get to the point where you're not having symptoms anymore. You can calm your immune system down. Yeah, I've had people with rheumatoid arthritis that are no longer rheumatoid arthritic. I've had people with Sjogren's that don't have that anymore. I have people with MS that don't have MS anymore. So you can get better. It's hard work once your immune system gets to that point. So that's why you don't want to get there. You want to prevent these things, right? So, leaky gut. Now, things that should not get through the lining of the gut can with leaky gut. So if your gut is so porous and permeable, what about nutrients? Are they getting through properly? So intuitively, you would think, oh yes, if your gut is leaky, everything should be getting through. But unfortunately, that's not true. The nutrients that should be absorbed well don't get absorbed well. So that's the irony, is that with the leaky gut, even if you're eating well, your vitamins, your minerals, those things may not be being absorbed well. So in time, you can become deficient to your nutrients while, gaining bad things happening in your body. So that's why we want to avoid leaky gut. And if we've got it, we've got to heal it. Okay, so here's my approach to healing the gut. It's called the 5 R's. It's not my 5 R's. Lots of naturopaths, have this process. Remove, repair, replace, repopulate, rebalance. So with Lucy, when she came to see me, I said to her, yes, you have rheumatoid arthritis, but what we've got to do is heal your gut first. So we began by removing the irritants, right? So where do you think I started? Do you think I started with giving her a whole bunch of pills to take? Where do you think I started? Diet. Exactly. Oftentimes we are our own worst enemies when it comes to diet. Even people that think they're eating very healthy, if you don't know what you're sensitive to, you could be eating things that are upsetting you and you don't even know it. I had a patient come in today. I saw him a month ago, and he had terrible eczema. And this fellow, I guess he was in his early 30s, and I thought, he's going to have troubles changing his diet. Bad, right? I was judging him. And so we did the testing, and we removed his allergic foods, just like we did with Lucy. And this fellow, he came back and he said, within 2 weeks of going off wheat, his eczema totally cleared up. And so I said, I'm really impressed, because I have to admit, I didn't think you were going to be able to do it. It's just my bias, right? I thought, 3/4 of my patients are women. And women are way more compliant when it comes to changing their diet, right? With this guy, I thought, no way he's going to be able to do it. So he did it. And I said, isn't that wonderful? He said, yeah, I've had this eczema for 2 years. And I've tried every cream out there. And by cutting out wheat within 2 weeks, my eczema was gone. So with Lucy, we removed the bad things in her diet. So some of that was, foods that she was allergic and sensitive to. She was a coffee drinker, and some people call me Dr. No Fun, because I tell my patients, if you have loose bowels and diarrhea, you shouldn't be drinking coffee, right? The roasted oils and the caffeine irritate the bowel. In fact, I have patients, that's the reason they don't want to give up coffee, is that in the morning when they have their coffee, that's what stimulates their bowel movement, right? And so if they don't have their coffee, they don't poop. So I said, we got to find a better way. So we had to get Lucy off coffee because I said to her, is it the energy you need? She said, no, it's not the energy, it's not the buzz, it's the routine, right? My husband and I in the morning, we have our coffee together and we read the paper. And I said, could you have another hot drink? She said, by all means. I don't need the coffee. I just do it to keep him company. Isn't that fascinating? Now, there are people that are addicted, right? I've had people come back cursing me because they were in hell that first week, right? Have any of you going off coffee experienced that? Or tried going off coffee and experienced that? That's how you know it's an addictive drug, right? How many people feel irritable and grouchy and headachy giving up broccoli? Nobody, right? That's because broccoli is not an addictive substance. When you feel good after your coffee in the morning, that's because you're an addict. And the dose of coffee has overcome the withdrawal symptoms that you've had from not having it in your body for those hours that you were sleeping. Yes, it gives you some energy, but the buzz, part of it is just getting over the withdrawal, right? So, yeah, the problem with me is that I've never drunk coffee, so I can tell people not to drink it, right? Because I never was addicted. Tea has caffeine as well, but the tannins bother some people and not others. I find that coffee can be more irritating to some people, and tea can be irritating to other people. So, what happened? I did the same thing. Maybe just being closer. Yeah, okay. I gotta almost eat it, right? Okay, that's better, right? So, removing not just the bad foods, but the microbes. Okay. I gotta almost kiss it. So, removing the microbes. When we did the testing with Lucy, she also had high levels of Candida. Now, Candida is not a parasite per se. I would say all of us, every one of us, has some fungal organisms like yeast in the gut. So if it's not a parasite per se, where did it come from originally? When did we first pick up yeast? From your damn partner? Yeah, you can pass it back and forth, but guess where? No, originally, what? Birth, that's right. Yeast is a normal organism that's found on the skin, in the lining of your gut, and in the vaginal tract, right? So when you're coming through the birth canal, we pick up our friendly bacteria then, but that's also when we pick up yeast. So everybody has some. Now you might say, well, I was born by C-section, so does that preclude me from having yeast? No, you can still pick up yeast. I had a patient, and she was quite close to being due. And I said, things are going well. Everything should be fine with your delivery. But if by any chance there's complications and you have to have a C-section, I want you to promise me to do this. And it's going to gross you out, but I want you to do it anyway, right? What do you think I had her do? What do you think? You got it. That's right. I told her, stick your finger in your vagina and inoculate your baby's mouth. And luckily, she knew me well enough and long enough that she didn't hit me with her fist, right? And she didn't think that I was kooky. She said, that makes sense. That makes sense. Children that are born by C-section have higher rates of intestinal problems. They have higher rates of allergies because they don't have the friendly gut bacteria. And you think, well, how can be gut when it comes from the vagina? Yeah, there's gut bacteria there as well, right? So it's really, really important. Get rid of the microbes, remove them. What else do you need to remove? As much stress as possible, right? With her, luckily Lucy wasn't under a lot of stress, but some of my patients are. So what that means is balancing your life and trying to get your life in as much order as possible, because when you're in that fight or flight state, your gut doesn't heal. Remove, repair, okay? So, we can't go to repair first. We got to remove the bad things first. Trying to repair the lining of the gut without identifying what the irritants are is like if you have a sliver in your hand, right? If you have a sliver in your hand, you can put all the salve and polysporin you want. That hand is still going to hurt. It's going to be red, it's going to be tender, until you do what? You pull the sliver out, right? So that's why remove is before repair. So repair. What are some nutrients that we can use to repair the lining of the gut, especially the small intestine? Acidophilus is definitely helpful. We're going to include that more in repopulate, but yes, because they produce substances that are healthy for the lining, especially of the large intestine, they help produce short-chain fatty acids called butyrates, very important for the colon health. What else? Something that starts with a G that bodybuilders take a lot. I heard it. Glutamine. Glutathione is a good substance as well, but glutamine is an amino acid. It's a building block of protein. It's the preferential fuel of the lining of your gut cells, your small intestine cells. By taking glutamine, you're nourishing and feeding the cells of your small intestine so that they can heal up, right? It gives them fuel to do what they should do. How about vitamins? What kind of vitamins do you think would be good for the healing the gut? Pardon? Not so much Bs. Bs are good for a lot of things. Somebody said D. Somebody said A. Somebody said B. All right. All those are important, but I prefer, if I'm healing, to use the A and D. Right? D, man, it's important for so many things, right? Traditionally, it's used to prevent osteoporosis because it increases calcium absorption. But it's very, very, very important for normal replication of cells. And we want the cells that line the gut to reproduce, turn over, heal, right? So we want the D. The A is extremely important. A is hugely important. A is underrated and underused, right? And I think part of it is because it's fat soluble, and some people are scared of fat soluble vitamins. Don't be scared of vitamin A. It is your friend, as long as you don't overdo it, right? Vitamin A, it's antiviral, it boosts the immune system, and it strengthens the integrity of mucous membranes. Mucous membranes. Your gut, mucous membranes. Your sinuses, mucous membranes. Your lungs, mucous membranes. I use A for anything to do with mucous membranes. I use A for skin-related things. I love vitamin A. Add that to your arsenal.
You should have, with your vitamin D, should it not be combined with vitamin K for better health?
Yep. So the comment was, if you're taking vitamin D, should you be taking vitamin K along with it? Absolutely. So, we're just talking about D right now. Calcium's important, but we're talking about what heals the lining of the gut. So the comment was, if you're taking vitamin D, you should take vitamin K. So aside from the lady that said that, why do you think if you're taking especially large amounts of D, why should you take vitamin K? And is it K1 or K2? K2, right. K1 has to do with blood clotting. K2 has to do with what? Yes, vitamin K directs calcium into the bones. When you take high doses of vitamin D, you're increasing calcium absorption through the lining of the gut. And we want that in order to prevent osteoporosis, right? But the problem is, when you get all that D in the blood, it can go anywhere. It can go in your kidneys and cause kidney stones. It could go into your artery walls and contribute to atherosclerosis. It can go into your joints, right? It can go to your heart valves. So what the vitamin K does is it directs the calcium into your bones and teeth where it belongs, so you don't get inappropriate deposition of vitamin D, of calcium. Okay, that's really important. Repair. The other thing that we repair in a lot of our patients is the liver, right? The liver, what does the liver do? Does it just sit there hanging out? What? Breaks down toxins. It's the number one job. The liver has many, it has so many different functions, but the primary function is breaking down toxins. And because we're living in such toxic times, our liver's getting overworked all the time, right? So it's very, very important for us to do things to repair the liver. And when you talk about immune system in the lining of the gut, there are all kinds of immune cells in the liver as well. And as the blood is being filtered through the liver, if there are bacteria and bad stuff, the liver's job is to break them down. The large intestine, right? People that have colitis, irritable bowel, those kind of things. The large intestine needs to be repaired. So that's where the probiotics really come in, because the butyric acid. When I was in school, you could actually dispense butyric acid capsules. I remember one time I had a patient with a bowel problem, and I prescribed the butyric acid. I said, this is the stuff that's going to repair your bowel, right? And he was really excited. Came back a couple weeks later, and he said, I couldn't take the stuff. It smelled like vomit. Butyric acid smells like vomit. So it's hard to get people to take it, but you can make it, right? Eating a rich, high-fiber diet and providing your body with lots of friendly bacteria, especially the bifidus bacteria, which are found in the large intestine, the bacteria can make the butyric acid out of your fiber. And you don't have to take something that smells like vomit, right? You know something else that has butyric acid that a lot of people love to put on their vegetables? Butter. Butter. Yeah. Okay. So, replace. What are some of the things that we might have to replace in an improperly working digestive system? Let's start up here with the stomach. What do you think might have to be replaced up there? Acid. Remember I said hypochlorhydria or low acid production could be a problem? So some people, I had a patient today, and she was having a lot of problems with flatulence, right? She said, it's embarrassing being out in public because I have so much gas that a lot of times it's hard to hold it in. And so oftentimes my husband and I don't go out because it's just too embarrassing. So I said 3 things could cause flatulence. It could be poor digestion, so inappropriate acid production or enzyme production. It could be foods that you're eating that you're not digesting well, not because you're low in acid, but things like cabbage family foods, beans. Some people, they just don't produce the enzymes that break those down very well. They're producing enough acid, right? And then the other thing is dysbiosis. So when she described her symptoms some more, I said, let's lean towards the low acid one first. So I prescribed a broad spectrum digestive enzyme for her. And she came back, and it had been 6 weeks since I saw her. And she said, the first 4 weeks, it worked really, really well. But the last 2 weeks, look at this. I'm doing this right, and it's still not working. Okay, there it is. So I said, that's really strange, because you would think that if you felt better the first 4 weeks, The last 2 weeks should have been good as well, right? I said, so let's think about what was different. What was different? What was different? What was different? What do you think was the difference? She ran out of enzymes. After she only had 4 weeks worth. So I said, that's perfect. That means that the enzymes worked, right? The 4 weeks that you're on them, your flatulence was better. Your husband could take you out. The next 2 weeks, you're flatulent again because you ran out of enzymes. And so she said, does that mean I have to take them the rest of my life? And I said, do you want to go out with your husband? I said, if you're not producing the enzymes, yeah, you gotta take them. I'm sorry, right? It's not a, yeah, it is a matter of choice. You do have a choice. You can take them and not have flatulence, or you can not take them and have flatulence. That's your choice. Wow. So enzymes need to be replaced. Nutrients need to be replaced. If you're not absorbing very well because of leaky gut, you want to replace the nutrients, right? So, for example, I have patients that have a lot of muscle cramps. And what mineral do you think is most important for preventing muscle cramps? I got a hand go up. Magnesium. Calcium can be helpful as well, but magnesium more, right? Magnesium is very important for relaxation of muscles. And like calcium, like iron, like zinc, you need good stomach acid to absorb magnesium. So in many people that have poor digestive function, either they're not producing enough enzymes or the gut is leaky and they're not absorbing magnesium, so they're prone to muscle cramps. I don't start by just giving magnesium. We've got to heal the gut, right? If we're just giving magnesium, it can help symptomatically, but that's not the cause. The cause was they weren't absorbing the magnesium, right? So some people, if they're really, really bad with their gut, and they're quite low in many nutrients, and one of the ways we do that, we find that out, is we can do hair analysis and see what minerals people are low in. So somebody's extremely low, and it's going to take time to get that gut working better. What is the way that we can get nutrients into the body bypassing the gut? Intravenously, that's right. And people say, well, you're a naturopathic doctor. You shouldn't be putting in things in people's body that way. And I said, yeah, it's still vitamins that I'm using. It's all legal. But if people aren't absorbing, then we put it in intravenously while we're working on the gut. And some of my patients, they do really, really well because, all of a sudden their energy's getting better, mental clarity, because now they're getting the nutrients that they weren't getting because of gut problems. Repopulate. So again, repopulating the friendly bacteria. In the last 5 years, there's been so much research on the field of probiotics and talking about the human microbiome that many researchers now believe that the probiotics, they're so important. They're almost like another organ in your body. That's how important they are, right? They're important for your immune system. They're important for your digestive function. They're important to help complete the breakdown of foods. They help with the breakdown of toxins. They help with the breakdown of hormones, right? They produce certain water-soluble vitamins. They produce short-chain fatty acids that nourish the lining of the gut. It's amazing how we've evolved with these organisms, and they need us, and we need them. I believe we need them more than they need us. Now, the reason that we have to repopulate on a regular basis is that I used to think these probiotics were permanent residents, and if you destroyed them and you put more probiotics in, then once you did it for a period of time, you could stop. But that's not true. And the reason is because they're only transient. They're only visitors. Many of the probiotics are visitors, and they leave, right? And what's one of the main ways that probiotics can leave your body? What do you think? And it's not vomiting. Vomiting is mostly stomach contents, right? So what do you think? Bowel movements, right? It's through your stool. Every time you have a poop, you're losing bacteria, right? The majority of the weight of your stool is mostly bacteria. So every time you have a poop, you're losing some of your friendly bacteria, right? we're being told, don't buy bottled water, right? It's not environmentally safe. Bring your water bottle and just drink tap water, right? Just fill your bottles up. So what are we getting when we use tap water? Chlorine. Chlorine kills your friendly bacteria. So again, if you're doing things to kill your friendly bacteria, they need to be replaced on a regular basis. Now, you want to use a probiotic that has many different strains, right? There are products out there that are designed for specific health concerns, right? There's VSL, Align is one that people have seen a lot of. The problem with some of these products is that they're a single strain of probiotic. There are 500 to 1,000 different strains of probiotics in your gut. So even when you're using a product that has 15 or 20 strains, it's a drop in the bucket compared to what's actually in your gut. Tonight's poopy talk because it's gut, right? So if you have C. difficile that is not responding to antibiotics, what is the cutting edge treatment now for C. difficile? Pardon me? Right, fecal transplant. And just as it sounds, fecal means poo. So what they do is they get a sample from a healthy person, so maybe a family member that doesn't have, hepatitis or some disease, and they test the poop first, and they make a slurry of it, and they inject it up the bum of a person with C. difficile. And the success rate is humongously good. Now they're using fecal transplants for things like ulcerative colitis. They're using it for certain other types of autoimmune problems. So at first I thought, well, why wouldn't somebody just, get some probiotic capsules and get an enema bag and just dump a bunch of capsules? And I've actually had patients do that because I thought, well, if a fecal implant works, let's just get a bunch of capsules and we'll put warm water in the enema bag, and we'll just open up a whole bunch of capsules and dump them in there and infuse it up the bum, right? And it does help. I had a patient, she was having 7 to 10 bowel movements a day. And this woman was still trying to work. Can you imagine? I can't imagine what her boss was thinking, right? Every few minutes she's off to the toilet, off to the toilet. So when I thought about it, she was taking the probiotics orally, and I said, maybe they're just not getting down low enough. Let's try to do it from the other end, right? And luckily, she'd done coffee enemas before, so she was quite comfortable with doing, the probiotics rectally. And it got her bowel movements down to 3 to 4 times a day, which is phenomenal, right, for her, from 7 to 10. But then I thought, how come the fecal implants are that much more effective? So I believe it's because there are all kinds of other probiotics that we haven't even identified yet. And there may be, antibodies and other things that are in the stool that are not in the probiotic capsules, right? So I had a patient today, and she's 25 years old, and she has ulcerative colitis. And she's told me all the things that she's done. She's been on, biologics for suppressing her immune system. They're not working. So guess what I suggested to her? Yeah, you bet. And luckily, she had already heard about this. And she said, we're from Courtney, and on the internet, I found that there's a doctor in Duncan that can do it. And I said, I am so grateful because I thought you were going to screw up your face and think I was an idiot. And she said, you know what, Dr. Yim, that's a great idea because the research I've read, huge success with ulcerative colitis. So I'm going to do it. Rebalance. That's not a brand of shoe. It means finding balance in your life, right? In Chinese medicine, there's a symbol with a circle and 2 teardrops, right? One black, one white. That's the yin-yang symbol. And what it signifies is balance. And the problem with us is that most of us don't have balance in our life, right? Some of us are just working too hard, not making enough time for leisure. Some people, they're exercising too hard, not getting enough rest. There's just a lot of imbalance. So when I work with my patients, I always try to determine what is their stress level and how can we work at, if not lowering their stress level, find ways that they can decrease the effects of stress on their body. Because when it comes to the gut, when it comes to the immune system, when it comes to your endocrine system, every system of the body is aggravated by stress, right? Even your brain. When I was studying for board exams, I would have my breakfast, work out at the gym, and then I would meditate for 15 minutes, and then I'd join my study group, and we'd study. And I swear that if it wasn't for my study group partners and my meditation, I probably wouldn't have passed, because it was a hard friggin' test, right? And so for me, meditation has really served me well in my life. It's gotten me through a lot by helping keep my stress level down. So I encourage you that, if you're having digestive problems, look into some way to decrease the stress in your life. And with Lucy, because she loved to dance, once her pain level was a little bit better, what we had her doing was Tai Chi. Because as a dancer, it was perfect for her because she had the mind for learning the steps. I've done Tai Chi, and at times, you'd learn like 2 or 3 steps, and it's hard if you don't have a mind for it, right? But for her, it was great. It was like moving meditation. When she was doing it, it took her mind off other things, and the style of Tai Chi that she was doing was the Taoist style, which is specifically designed for health, right? And it worked wonderfully for her. So, for yourself, look at things. If you're not one to sit still, I had a patient this morning, and she was older, and she had lots of time, so I thought, meditation would be great. So I brought it up to her, and she said, nope, can't do it. And first I thought, maybe, is a religious belief or something like that. She said, no, I have this mind that doesn't sit still. I can't still my mind. And I said to her, you're the one that needs it the most, right? It's people that can't still their mind that need meditation the most. I said, there are all kinds of different techniques out there. Work with somebody. There's all kinds of trainers. There's free stuff on YouTube. But if you have a hard time stilling your mind, you need to learn to meditate. So rebalancing is very, very important when it comes to gut health because it encourages the parasympathetic nervous system to be more dominant. And when we can do that, in that state, the body heals. It regenerates in parasympathetic. In sympathetic, which is fight or flight, that's survival mode. All you're trying to do is survive. And disease happens more when you're fight or flight. So, how does Lucy's story end? Well, 3 months after we started working together, Lucy's IBS gone. 6 months after we started working together, her joint pain was down enough that she was able to dance at her grandson's wedding. Now that's a happy ending, right? That's a happy ending. So what I want to do is recap really quickly and then open this up for questions, and we're going to do the draw for the gifts, okay? So I want to emphasize that if you have digestive symptoms, no matter how minor they are, right? Some people say, it's just some gas, it's okay. No. Listen to your body. Don't ignore your symptoms. Do something about it because those digestive symptoms can lead to other health problems. And if you already have health problems, then consider treating the gut. Because if you want to have vibrant health and you want to have vitality, you've got to have a healthy gut. Remember, the title of the talk, Healthy Gut, Healthy Body.